Depression by Weiss and Alec.
What is depression? Depression is when everyone occasionally feels blue or sad. When you have depression, it interferes with your daily life and causes pain for both of you and those who care about you. And it's a very common illness. Poor countries are facing more depression than richer countries, although France and USA, very wealthy countries, are the most depressed because France's farm social system is under attack, with many seeing a decline in welfare state and education system. Difference between diagnosis and depressed mood. When you are depressed, the feelings do not go away. They persist and interfere with your everyday life. Symptoms include sadness, loss of interest or pleasure in activities you used to enjoy, change in weight, difficulty sleeping or oversleeping, energy loss, feelings of worthlessness, thoughts of death or suicide. Difference between diagnosis and depressed mood. When you are in a depressed mood, you occasionally feel blue or sad, but these feelings are usually short-lived and pass with a couple of days and are very different from being depressed for a long time. The major causes of depression. Um, Depression is caused by a combination of genetic, biological, environmental, and physiological factors. Some types of depression tend to run in families. However, depression can occur in people without family histories of depression too. Scientists are also studying certain genes that make some people more prone to depression. How to cope with depression. To deal with depression, you should visit a doctor or mental health specialist. Certain medications and some medical conditions such as viruses and thyroid disorder can cause the same symptoms as depression. A mental health professional should discuss with you any family history of depression or mental disorder and get a couple history of your symptoms. You should also discuss when your symptoms started, how long they've lasted, how severe they are, and whenever they have occurred before, and if so, how they are treated.
How to cope with depression. Once diagnosed, a person with depression can be treated in several ways. The most common treatments are medication and psychotherapy. Antidepressants primarily work on brain chemicals called neurotransmitters, especially serotonin and norepinephrine. Other antidepressants work on the neurotransmitter dopamine. Scientists have also found that these particular chemicals are involved in regulating mood, but they are unsure of the exact ways that they work. How to cope with depression. You can try to be active and exercise. You can also go to a movie, a ball game, or another event that you really enjoy. Set realistic goals for yourself. Break up large tasks into small ones and set priorities and do what you can as much as you can. Try to spend time with other people and confide in a trusted friend or relative. Do not try to isolate yourself and let others help you. Expect your mood to improve gradually, not immediately. Do not expect to suddenly snap out of your depression. Often during treatments for depression, sleep and appetite will begin to improve before your depressed mood lifts. Depression left untreated. Untreated clinical depression is a serious problem. Untreated depression increases the chance of risky behaviors such as drug or alcohol condition. It can also lead to suicide. It also can ruin relationships, cause workout problems, and make it difficult to overcome serious illnesses. Clinical depression is an illness that involves the body, mood, and thoughts. Clinical depression affects the way you eat and sleep. It affects the way you feel about yourself and those around you. It even affects your thoughts. Clinical depression that is untreated can last for many weeks, months, or even years. Depression left untreated. The most recent studies exploring health and major depression have looked at patients with stroke or coronary artery disease. Results have shown that people with major depression who are recovering from strokes or heart attacks have a more difficult time making healthcare choices. They also find that it's more difficult to follow their doctor's instructions and to cope with the challenges their illness presents. Another study found that patients with major depression have a higher risk of death in the first few months after a heart attack. One of the most telling symptoms of clinical depression is a change in sleep patterns. The most common problem is insomnia. People sometimes feel an increased need for sleep and experience excessive energy loss. Lack of sleep can cause some of the same symptoms as depression. In addition, untreated depression may result in weight gain or loss, feeling of hopelessness or helplessness, and irritability. Treating the depression helps the person get control over all these depression symptoms. How to prevent depression. Although depression is a highly treatable condition, some forms of depression may not be preventable. That's because depression may be triggered by a malfunction of nerve cell connections in certain brain circuits. However, the latest medical study confirms that depression may often be alleviated and sometimes prevented with good health habits. Eating a healthy diet, getting regular exercise, and taking time out for fun and relaxation may work together to prevent a depressed mood. You can also hang out with your friends or family and spend more time and have more conversations and try to forget about your depressed mood. How to prevent depression. You can take steps to control stress to increase your resilience and to boost your self-esteem. Reach out to family and friends, especially in times of crisis, to help you through rough times. You can get treatment at the earliest sign of a possible problem to help prevent depression from worsening. Consider getting long-term maintenance treatment to help prevent a relapse of symptoms. The sources we used that were most useful were the NIH.gov for mental health, WebMD, CDC, and Mayo Clinic. And the last two were the photos.